Hey guys, so today we're going to talk about some bone clues. So let's say that you don't have any soft tissue. All you found is a pile of bones. You've got these skeletons and you're trying to figure some stuff out. Maybe who your victim is, maybe some information about your victim. What can you figure out based on bones? So the first thing we're going to talk about are some of these constructs that we use when we categorize humans. And the next slide is one that sometimes kids say, we've heard this a million trillion times before. We don't need to hear this anymore. Some other kids, it's new. So we're going to go over it. But it's this idea of that fact that sex and gender are not the same thing. So sex is biologically determined. But there are like a million billion different ways that we can biologically determine sex. We can look at chromosomes, we can look at external genitalia, we can look at the hormones that are coursing through our body, we can look at the receptors for those hormones that are coursing through our body. There's just all kinds of different things that determine sex, and that's biological. Biological sex, though, is often conflated or confused with our gender, and our gender is our expression. You guys have definitely heard about gender identity. If we think of ourselves as a female, a woman, a girl, the way we dress is our gender expression. The way we do our hair, the way we sort of behave, and that has a lot to do with our social norms and what we think boys should do and what we think girls should do and how each of them should behave. And I am personally loving the way those lines are getting blurred more and more every day. There's our sex assigned at birth, which is, when we came out of our birth mother and the doctor held us up and went, it's a boy or it's a girl. And that, of course, was based on external genitalia. And that's typically what we're using when we do a lot of our forensic work. And then there's, the who we're physically attracted to and emotionally attracted to, and that's not at all in our anthropological concern right now. So I just want to be really clear that it gets confusing in forensics because somebody may identify as one particular gender and they may live their life as a particular gender. Biologically, maybe they're sex assigned at birth and their chromosomal sex may be different from that. And so if we're doing a forensic investigation, we do always have to keep that in mind. When we are talking about sex from looking at bones, we are talking about that biological sex. We're not talking about gender expression ground. All right, so when we find a pelvis, we are going to look at a couple different things to determine if this came from a male or a female. Now, again, plenty of people who are gender fluid, we're working with the two biological sexes, male and female. So there is this thing called the subpubic angle. So when we look at the pelvis, there is an angle right here that is called the subpubic angle. When we have a narrow subpubic angle, like you can see here, when we have a narrow subpubic angle, that tells us that we're probably looking at a pelvis from someone who was male. When we're looking at a wider subpubic angle, that means we are probably looking at someone who was female. So I have two different pelvises here, and you can take a look at them and you can see a narrow subpubic angle here. So this is probably a pelvis from a male. And then you can look at a wider subpubic angle here, and this is probably from a female. That makes sense because a baby has to come through here. And so we definitely want to have more space for the baby to come through. A baby trying to come through this space is going to be in trouble. So biologically, it makes sense that the sex of human who is typically procreating for us and creating the babies is going to have this wider subpubic angle and have room for a baby to come out. Another thing we can look at is the sciatic notch. So we have a nerve called a sciatic nerve that's going to attach. That's where you hear the old people say, my sciatica. And it's because their sciatic nerve is hurting them. So if we take the pelvis and we turn it sideways, we have our sciatic notch that's here. Once again, if we have a narrower sciatic notch, then we are probably looking at a male pelvis. Whereas if we have a wider sciatic notch, we are probably looking at a female pelvis. Now, the thing that's tricky is that sometimes you don't get a full pelvis because here's the deal. This is a bunch of different bones that are being held together. You can see that, like, for the purposes of my model, there are some bolts here holding things together. There are some little screws here holding things together. We have some cartilage, some stuff representing cartilage here holding stuff together. So it's possible that you find just this bone. And if you find just this bone, then you're going to have to approximate the subpubic angle, but you do have the sciatic notch there. So that's just something to keep in mind when looking at individual bones. When you look at the overall pelvic cavity, so this is on an x-ray, so we're almost looking down, you can see, again, logically, that one sex has a much wider pelvic cavity and one sex has a much narrower pelvic cavity. Well, the one that's going to have a baby coming through it is going to be the female pelvic cavity. So again, if you've got the entire pelvis and you can look at this space, this pelvic cavity, you're going to have a much bigger space here in a female pelvis. You're going to have a much smaller space here in a male pelvis. Side note, this is an IUD. So this is a person who is trying not to have a baby come through their pelvic cavity. All right, another thing we can look at is the femur. I didn't bring my femur over here. Hold one moment while I go get my femur.
A few moments later.
Okay, I have my femur. So if, let's say, we have a femur, and we all know where the femur is now, it's the large bone in our leg, our thigh, our upper leg bone. If we have a femur, we can find the head of the femur, and we can measure the head of the femur. So we would use these things that are calipers, and these calipers are good for measuring things that aren't nice and flat. So a ruler is good for measuring flat things. Calipers are good for measuring round things. So we can measure the head of the femur like this. Find the size of the femur. This appears to be at about 39 millimeters. And so this is probably a femur from a female. So if the head of the femur is greater than 48 millimeters, we're probably looking at a male. If the head of the femur is less than 43 millimeters, we're probably looking at a female. Anything between 43 and 48 millimeters, it's going to be tricky. We're going to have to look at some other clues. Maybe we also have a pelvis, and so we can put that information together with the pelvis. Maybe we can also look at the bone length. That might help us with some information. Right, another thing we can look at is the skull, and we can look at the brow ridge here. Basically, what I describe it as is you're looking to see, do they have sort of a bony eyebrow? This is our female skull. We've looked at this one before. This is the one that has the gunshot wounds. If you look, you can see that her brow ridge is pretty smooth. There's not really anything happening here. If you look at this male skull, in the male skull, it looks like there's little bony eyebrows here. He's got a little brow ridge here. And so we can tell that this is probably a skull from a male because he's got the little bony eyebrows. Whereas, again, if you look at our female skull, there's no little bony eyebrows. So the brow ridge on the skull can help us tell if this person is male or female. There's another thing called the mastoid process over here. And in the mastoid process, it's going to be a lot larger on the male than it is on the female. So again, this is my male, this is my female. Check out the mastoid process here versus here, and you can tell that there's a different size. Same thing in the two pictures. If you look at the skull marked A, there's a much larger mastoid process. If you look at the skull marked B, there's a much smaller mastoid process. All right, now let's talk about race, because race is just as dicey. Race is not biologically determined in any way. There is nothing that biologically determines race. Absolutely nothing. All the things that we think biologically determine race, like what chromosomes determine our skin color, what chromosomes determine our hair texture, the shape of our noses, all of those things are individual and independent from any other governing structure. So there is nothing biologically that determines race. There are things that biologically determine those characteristics. We as humans have dumped all of those physical characteristics determined by genes into categories that we call races. But that's not biological. However, because we want to be able to narrow down categories, we're going to do that kind of stereotyping of the bones we find to try to narrow down what's going on. Mainly when we talk about race, we're going to do it with the jaw and looking at the teeth. So if we look at the dental arch, we're going to see some different shapes. So if we see a shape that is parabolic, that is a parabola shape, if we see a parabola shape in the arch, then we're going to say this is probably what we call the Caucasoid people, meaning European, white folks. Okay. If you look at the hyperbolic, which is more of a U shape, this is our African ancestry, more of a U shape. Okay. And then our last one is more rounded, and this is going to be our Asian ancestry. Interestingly, our Asian ancestry is also going to include Native Americans. And by Native Americans, I mean Native North Americans, Native South Americans, any indigenous peoples of the Americas. And that's because of the Asian people who came across the land bridge a million, bajillion, batrillion years ago. So if you look at the jaw, you may be able to tell something about the person's ancestry. Now, we do always have to keep in mind that this is usually not always. Another thing we can do is we can look at the incisors. Those are these front teeth. When we look at incisors and we see that they are spatulate, meaning looks like a spatula, okay? When we see that they are spatulate, that tells us that likely we are looking at someone who was Caucasoid, so a white person, or European ancestry, or of African ancestry. If we look at them and we see these shovel shapes, so if we see these little indentations, these shovel-shaped incisors, that tells us that this person may be of Asian ancestry. And there you have it, bone clues. Hopefully you learned a few things about bones and what you can do if you find a pile of human bones. Okay, that's gross. You should call the police.